morning and welcome back. A special good morning to Tobago. We are talking about physiotherapy. World Physical Therapy Day is Friday, September 8th, same day as International Literacy Day. The day is an opportunity for physical therapists from all over the world to raise awareness about the crucial contribution that this particular profession makes to keeping people well, mobile and independent. Now, the overarching theme for World Physical Therapy Day each year is the movement for health. This year, the theme is Physical Activity for Life, highlighting the important role that physical therapists play in healthy aging. And with us in studio from Tobago, we have Dr. Karielle De Bique, a physiotherapist at the Tobago Regional Health Authority. Good morning. How are you doing?
I'm great. Good morning, everyone. Good morning, Trinidad and Tobago.
And how is Tobago this morning?
It's wonderful.
All right.
It's a little rainy.
It is?
But it's wonderful.
Okay. Now, what do physiotherapists do that are particularly different in the healthcare arena?
Our job is really looking at movement and exercise. We're the movement and exercise specialists in healthcare. So we look at you from the time you are born or just before that even, all the way until you are a lot older and probably on your way to dying. So we look at palliative care, we look at newborns, we look at everything that could be possibly affected by exercise, and we get involved there.
Now, in terms of the public service and the face of public service, what is particularly different here?
What's different in Tobago and what's different in physical therapy generally is that we have a multidisciplinary approach to care. We involve all areas in your care. So let's say you're an arthritic patient. We look at your pain, we look at how it's managed, we look at how you can adjust your lifestyle to ensure that you function well. So what do I do? What is affected by my activity and what brings on my pain? How can I strengthen that and carry you further, closer to your goal of achieving whatever you want to? I want to go back to gardening. I want to get up and move about the house. I want to drive. I want to move about in activities. Physical therapy gets involved from an exercise perspective. We look at the movement challenges involved in that and carrying you further.
Okay, and what exactly do you all treat? Is it like pinched nerves, muscle spasms? What do you all treat?
If you have a movement problem, we can be involved. Arthritis, stroke, neck problems, back problems, and that's orthopedic related. We get involved with people before open heart surgery, after open heart surgery. We get in, and that's from the cardiovascular perspective. We look at persons who have circulatory problems and look at exercise related to that to be able to assist with muscle function and encourage blood flow to return to areas it needs to have to. We look at the ability of a child to be able to move. So you have a child that's not moving at all. We look at keeping joints supple, moving and allowing muscles to lengthen and contract. Positioning to allow your child to be in the most comfortable position for them, the most effective position for their heart to work, for circulatory function to happen, for them to breathe properly. So just sitting down in a slouched fashion, for example, looking at supporting related to positioning on wheelchairs. We look at if the child, for example, is really tight. That's the best description I can use that people understand. So your muscles are really tight, your joints are really stiff. We look at teaching parents how to keep moving that limb, how to keep moving the body so that we actually get function that we need and we can interact better with our environment.
Dr. De Bique, I'd like to ask you, how active are we as a population here in Trinidad and Tobago? I mean, sometimes you travel abroad and you see tourists, you see foreigners. They're carrying around their weights or their exercise mats and they're making sure that exercise is a priority. Would you say that our population is in fact focused on exercise and movement?
From our statistics, it does not show so. We have been seeing a lot less activity worldwide, and we're also seeing a lot less activity generally within our population. We are even seen to be one of the more obese populations worldwide. It says that physical activity, therefore, is not high on our priorities. We were getting much more money, and therefore we were able to get our tablets, we were able to get our cell phones, and we give that to our children, and we say, please, enjoy that. Take the time, while I'm doing this, you can sit down and use the tablet.
So it's something we definitely need to work on.
We need to get physical activity into our lives.
Yes, include it in the agenda as a priority. Thank you so much, Dr. De Bique, for making the time to chat with us this morning on a topic that is so very important to us.